Pulse Health operates private hospitals. The company's portfolio, which is currently across New South Wales and Queensland, includes rehabilitation, mental health and regional acute hospitals and day surgeries. I'm Lelda Smits, and joining me at ASX Investor Series in Sydney is the company's Managing Director and CEO, Phillipa Blakey. Phillipa, welcome.
Thank you. It's a pleasure to be here.
Could you start by outlining where are your assets located and also what are your plans to expand your footprint?
So our assets are at the moment only in New South Wales and Queensland. We have two in Metro Sydney and the others in regional New South Wales, and we have some on a new one coming on the Gold Coast, a couple on the Sunshine Coast, and then in regional Queensland. And in terms of expansion, we're interested in expansion and looking at opportunities throughout New South Wales, Queensland, WA and Victoria, but moving away from the focus on the regional areas and more towards metro or fringe metro where the demographics are more supportive of with scale and growth.
Excellent. Now, Pulse Health has tied up a number of divestments and acquisitions this year. What are some of the highlights?
Yeah, it's been really good to really crisp up our strategy and be able to focus more on our core business. So we've divested our community care business, and our strategy is to focus purely as an operator of private hospitals and day surgeries. So we've sort of cleared the deck of non-core assets, and we're about to actually close one of our smaller hospitals in regional Queensland and move. We've also just done a great acquisition here in Sydney of a Hills Clinic, a beautiful quite new mental health clinic. It's 59 beds, regarded as probably one of the top mental health hospitals in Sydney. And we've also got our hospital that we're commissioning on the Gold Coast, and we'll have the first patient on the table there in September. That's a specialist surgical hospital, have a really wide range of surgery available on the Gold Coast.
Fantastic. And how did your hospitals perform over the first half, and what are your expectations for the remainder of the year?
We performed well in the first half. I was pretty happy about that. We saw a good 12% increase in revenue and a good lift in NPAT as well. And our guidance for the year was for a 20% growth on EBITDA from last year from existing assets, and we confirmed that guidance at the end of H1, and we've continued to confirm it since then. So the expectation is certainly that we'll achieve that.
Okay, and Phillipa, what factors in the healthcare market do you believe will continue to support the company's growth?
I see the regulatory regime as continuing to be very positive and in our favour, because it's going to be important for government to continue to maintain a high take-up of private health insurance because of the growing demand and pressure on the public system to meet growing healthcare needs. Then we have a growth in the ageing population, whereby we'll go, in terms of Australians aged over 65, we'll go from 1 in 7 to 1 in 4 by 2050. So that's a big change. And of course the other thing that's changing is technology and improved chronic disease management. So more people alive and well for longer, needing more access to healthcare.
Okay, and final question, Phillipa, what is the company's outlook for its finances and operations for the following year?
Yeah, well, for the reasons I was just outlining in terms of our external environment, the outlook I see as being very positive. And also because investors and people looking for places to put their capital understand that the environment's a good place to be. So from a financial point of view, we expect to continue to have good access to capital. About a year ago, I sort of set what I saw as a stretch goal being to double in size by 2017. And by size, I was talking about probably a mix of profitability and a mix of size of portfolio. And I think we're very much on track to achieve that.
Fantastic. Well, thank you so much for the update from Pulse Health today.
It's a pleasure. Thank you.